everyone. My name is Nick Panay. I'm a consultant gynecologist at Queen Charlotte's and Chelsea and Westminster hospitals, and I'm a professor of practice at Imperial College London. I'm past chair of the British Menopause Society and currently on BMS Council, and I'm president-elect of the International Menopause Society. Vasomotor symptoms are a very common set of symptoms, so hot flushes and sweats of menopause, and occur in 80% of women, and a third of those find them extremely distressing. But we often forget about the other symptoms, which can be even more distressing to the women that I see in my clinics and also reported in studies. For instance, the impact on mood can have a profound effect on a woman's ability to function personally, socially, and professionally. And often this is interlinked, if you like, quite intimately with cognitive problems, so memory problems. And the combination of these two symptom sets, which are particularly prevalent in the perimenopause transition, can be very distressing. Other symptoms, which again are often forgotten, are the musculoskeletal symptoms, so aches and pains, bone ache, joint ache, muscular aches, and just not being able to have the energy and the mojo and the joie de vivre to be able to function as effectively and as efficiently as a woman has done in the past. It can be very difficult to get going in the mornings, for instance. Another symptom, which I think is still taboo, is low libido, so low sexual desire, which is distressing to not only the individual but the couple. And this is something which needs to be proactively brought up in consultations because it's often not volunteered. A survey has shown that only 1 in 10 will volunteer symptoms of low libido unless they're asked directly about them. And then another area which I think is still taboo is vulva-vaginal atrophy symptoms, VVA, vaginal dryness, pain on intercourse, and also recurrent bladder infections. And this can very easily be treated, so it's so important that, again, we proactively volunteer these symptoms and that healthcare professionals ask about them. In terms of treatment for menopause symptoms, hormone replacement therapy has been the staple diet, if you like, for many, many years. But there are other treatments emerging, and I'd like to talk about these. But first of all, it is so important that before we talk about hormones and alternatives, that we ensure that as healthcare professionals, we've asked our women about lifestyle, diet, exercise, stopping smoking, reducing alcohol consumption, and any treatment should be underpinned by these fundamentals. In terms of hormone therapy, there have been some misunderstandings and misconceptions about the benefit-risk balance. And I want to make it very clear that for the majority of women that don't have contraindications to hormone therapy, the pros generally outweigh the cons. And we know that hormone therapy can help not only hot flushes and sweats, but also the broader symptoms that I've talked about. It can protect the bones. It can also reduce the risk of future cardiovascular disease if started early in the perimenopause transition, and may also have a long-term benefit on cognitive functioning, but this requires confirmation. Breast cancer remains an issue, but the risks are small, particularly with the new body or bioidentical type regulated hormones that are now available. And a good healthcare professional should be able to put those benefits and risks into balance for you. Complementary therapies lack an evidence base. There are some that are more evidence-based than others. We need better research, but it can be confusing for the individual going to the pharmacy trying to choose the right preparation. But there are certain preparations, such as red clover, soy-derived preparations, black cohosh, St. John's wort, that have been shown to be of some benefit. Cognitive behavioral therapy and yoga are also complementary therapies, which can certainly be of benefit for symptoms. And then there are pharmacological options for women who are unable to use HRT, for instance, if they've had breast cancer in the past. These tend not to work as well as hormone replacement therapy, but we are doing some research at the moment looking at a new group of drugs called the neurokinin receptor antagonists, which are very promising and seem to relieve symptoms as effectively as hormone therapy with minimal side effects. And hopefully these will be available in the next year or two. In order to optimize bone health, once again, it's very important to stress that weight-bearing exercise, which includes walking, doesn't necessarily have to involve running or lifting weights, and that, in fact, can be difficult for some people. And getting your 10,000 steps a day is a great way to achieve that exercise and weight-bearing exercise. Having a well-balanced diet, which contains adequate calcium, and for those who are vegan or vegetarian, they may need to supplement, and vitamin D, which particularly in the UK, we're often starved of sunlight, and particularly in the autumn and winter months, vitamin D supplementation, I think, is important in order to maintain the levels, and that will facilitate absorption of calcium. For those women who are predisposed to osteopenia or osteoporosis, it's really important that they are given the option of hormone therapy, and if hormone therapy is contraindicated, then there are bone-sparing alternatives that can be used. It's really important to bear in mind that even with optimum lifestyle and diet and avoiding smoking, minimizing alcohol, a significant proportion of women will still suffer from osteoporosis, up to 50% in women over the age of 80. And so it's really important that if you do have a family history, for instance, of osteoporosis, or if your periods have stopped early, or if you've been a heavy smoker, that you volunteer this information to your healthcare professionals in order that you can have bone screening. A simple bone density scan, very low dose radiation, will let you know whether you are at risk or not, and then appropriate lifestyle measures and medical interventions can be put into place if required. And that is why this important subject is the theme of World Menopause Day on the 18th of October this year. And also, as well as bone health, we mustn't forget that muscle health is integral to this, because the risk of fracture is also dependent on how healthy the muscles are. So again, this is where exercise is vitally important to keep the whole musculoskeletal system as healthy as possible.